Hi, I'm Fiona Mactaggart. I'm Member of Parliament for Slough, and I'm here with Caroline Flint, who's Public Health Minister, and I'm using this opportunity to put to her questions that people in Slough have asked me about public health issues. The first one, Caroline, I got when I was icing schools on Red Nose Day, and it was, why not more chips?
Well, I mean, we often have this problem about children in schools where the menu's changing. When you're used to something, it's very hard to make those changes. And, you know, chips are still there, but maybe not as many chips as before. And why is it important? Because I think in Slough, around 24% of people in Slough are diagnosed as obese. We know that obesity can lead to type 2 diabetes, some cancers, heart disease. And, you know, clearly we want to try and make sure that, you know, from the very earliest age, children can have a varied diet. That doesn't mean you can't have chips ever, or you can't have cakes or sweets, but it's just where it fits in the mix. And, you know, healthy eating can be fun. It doesn't have to be boring. And actually schools can work with kids to actually think about the sort of menus that can be exciting. But,
Certainly.
you know, it's so important.
One of the things that I've seen going around schools is and it's the thing that's been most exciting in terms of school diets, is the school fruit scheme.
Oh, yeah.
Which has made such a difference to the range of foods that the children in Slough eat. So.
And what's so wonderful is that it does, you know, lead on to children sometimes eating more fruit at home and trying things.
Absolutely.
I mean, it's quite hard for families when, you know, they might have a limited budget. They don't want to buy stuff and then find the children don't like it. So when school has some new fruit and veg, it can help. And if our supermarkets could do taster sessions for kids to try things out, so mums can feel more confident about when they're buying some of these different fruits. But I think the school fruit and veg scheme is a very good example of how the government is really trying to sort of give this opportunity for children to try things and then parents to carry on at home.
Right. Well, it wasn't just children who gave me questions to ask you. I've got this one from Nick Wade, who put in a lot of questions.
Yeah.
His concern is about people looking after their own health, about vitamins and supplements. He thinks that the government isn't serious enough about using vitamins, using supplements, and says that, you know, unless we get people to take better care of their own health, then the National Health Service won't be able to cope as we get older. What do you say to that?
Well, Nick's absolutely right about taking care of our own health, Fiona, because, you know, some of the conditions and diseases that we're seeing more of today are in part due to the lifestyle we lead, the sort of diet we have, the lack of exercise, the amount of alcohol we drink, and also smoking, of course, which is, you know, a major factor in disease and often tragic too early deaths for too many people. So nutrition is important in all that. What I would say to Nick is that first of all, we can have a balanced and nutritious diet just through the foods we eat, and getting that mix is important. But I think, you know, vitamins have a role to play. I take a multivitamin myself, and what we're trying to do, particularly with our role in Europe, is to make sure that any of the legislation in Europe doesn't create a damaging situation for our vitamin and supplement industry here at home. But what is really important is that people who buy these vitamins and supplements are clear about what they can and what they cannot do, but also that they are reassured that there's safety when they purchase these supplements and vitamins in terms of how much they should have at any one time.
Yeah.
So we are supportive, and actually, you know, I had a meeting just a couple of weeks ago with people from the various health and vitamin manufacturers and retailers to talk through how we're going to try and make sure we can protect our own market here in the UK, and with that protect consumers' right to choose to purchase vitamins and supplements.
Can I also get you to take back to the Department of Health his suggestion that in the private sector they tackle infections like MRSA with massive doses of vitamin C? Now, I don't expect you to answer that yet, but...
Well, I don't know the answer to that, and I think it's better to say that if you don't. But I think, again, we're exploring with things like MRSA just how we can be more effective in tackling it. We all know that one of the factors around the increase of MRSA is overuse of antibiotics. It's one of the reasons why now we ask PCTs to monitor the prescribing of antibiotics by different GPs. But again, you know, that's an interesting. I'll take that back into the department because you never know when there's, you know, not a gem that we might have missed here that can help us.
It's one of the great things about the web, isn't it? That people can pass on those ideas.
Exactly.
The other thing, and I've spoken to you often about this, is that when I was first elected, Slough was in the top 10 towns in the country for early deaths from heart disease. we're getting that down rather fast. I mean, everywhere it's falling, but in Slough we think it's falling a bit faster than elsewhere. And I just wonder if you could say, what are the things that people who are watching this webcast can do themselves? I'm at the moment doing with our health activists a healthy eating kick. I've lost a bit of weight. But what are the main things that people can do to avoid the big killers, heart disease and cancer, of course, as well?
Well, a balanced diet and exercise is really important, but also I think it's about sometimes just checking things like your blood pressure and going for a test. And I think one of the reasons why Slough has been so successful is that they've taken a proactive attitude. I know that a project we've talked about a lot is identifying that within our communities there are sometimes people, and sometimes women more than men, who are more vulnerable to, for example, diabetes. We know the Southeast Asian community in Slough particularly. So in Slough, instead of just sitting back and say, well, we'll just wait for people to come to us, they proactively went out, looked for people, got them to come and have a test for diabetes. And as a result, some people clearly did need to come in and talk through about diet and exercise. For others, it wasn't a problem, but it made them think about their own health. And what I want to see, and I know you do as well, is a health service that is just as much about prevention as it is about treating sickness. Because if we can get ahead of the curve, we can, yes, save a lot of money, but a lot of heartache for people, because, you know, living with a long-term condition isn't easy. And if we can do anything to reduce the numbers of people who do develop things like heart disease, type 2 diabetes, that has to be good. But we have to be out there, we have to be proactive and, you know, going to people rather than always expecting people to come to the health service.
I think you're quite right about that. Actually, one of the interesting things about the new diabetes clinic is we have a 98% attendance.
That's fantastic.
That we never used to have at the old one. And the one thing I'd say to anyone watching is get your blood sugar tested. You can even get it tested at a pharmacy.
Yes.
Check it out, because if you have diabetes, it can be controlled. But if you don't know you've got it, you won't be able to control it.